If you've got ACL surgery coming up and you're absolutely dreading it, then this video is for you. Fear is completely valid. It's a big operation. It's a long road to full recovery, and the unknown is the scariest part. But the good news is, people that go into it mentally and physically prepared consistently have better outcomes. And that's what this video is all about. By the end of the video, you'll know exactly how to get yourself in the best position to give yourself the best start to recovery. Before I get into it, I put together a short ebook. It's a bit of a guide as to what's to come, the kind of timelines to expect, and a few of my top tips. It's called the ACL Survival Guide, and you can download it for free through the link in the description below. So why and how does preparation lead to better outcomes of ACL surgery? Most people get the surgery date and do nothing with it. Just wait for the date to come thinking, well, if I do anything now, I'm going to be sat still for a few months, so it's a waste of time. But that's not the case, and it's actually quite a big mistake. The research is pretty clear. People that go into surgery with good quad and hamstring, both strength and range of movement and minimal swelling, have significantly better outcomes up to 2 years post-op. Think of the surgery as the starting gun, not the finish line. And what you do in the lead up to the race determines the outcome. Going in strong means you come out stronger. So first we'll go through prehab. What is it and why should you do it? 3 main goals of prehab are to eliminate swelling, or at least reduce it. And you can do this through icing regularly, keeping the leg elevated, and avoiding anything that might aggravate it. The second goal is to regain some of the range of movement you might have lost. Now, some of this will come from reducing swelling, but there's other things we need to do to increase it a little bit more. You want to get your knee bending and straightening as much as you can before you go into the operating theatre. And then finally, we want to improve quad and hamstring strength. You've lost a little bit between the injury and whatever point you're at now. So if we can regain some of that before we go into surgery, then there's less to catch up on the other side. And you want to aim for around 90% of your uninjured leg. A few exercises that you might want to consider are things like straight leg raises, terminal knee extensions, which I use a lot in the early stages of rehab after the surgery, mini squats or wall sits, as long as obviously pain and swelling will allow you to do them. Low impact cardio, things like cycling are really good because they're no impact. You can get your cardiovascular system going and it often doesn't aggravate the knee. And if it does, you can adjust the height of the seat, just take a little bit of the load off. Calf raises, just think the stronger and more mobile you are going in, the easier the early weeks post-op will be. Now here's something a lot of my patients find really helpful. What kind of things should you buy? You could end up spending thousands on gadgets, gizmos and tech to help your recovery. But here are the ones I recommend. Some kind of leg wedge or pillow to add a bit of support. Keeping the leg elevated in the first 1 to 2 weeks dramatically reduces swelling. And a proper wedge and something that's designed specifically for knee surgery is going to be a lot more supportive than your average pillow that you've just whipped off your bed. An ice or cryotherapy machine, especially one that adds a bit of compression as well. If you can find one that does both of these things, it's a complete game changer. They're far more effective than ice packs, and you don't have to go all out and get the £1,000 ones that Premier League footballers get. There's some affordable ones on Amazon, and I'll stick that in the description below. But in my experience, they're completely worth every penny. An EMS machine, or something like a Compex, which is, it's a little electrical machine that attaches to your quads and sends little electrical impulses into your muscles and gets them tensing. And that just fights the effects of any muscle wastage, any loss of strength, especially in the early phases where you can't do things like squats, lunges. It just adds a bit of stimulus to your muscles to help reduce any muscle loss and keep things kind of level. And then there's some supplements to consider. Collagen, especially one with a vitamin C included, is really good for repair of soft tissue, especially ligaments, which is what you're having reconstructed when you're having ACL surgery. Protein, which is always good, especially if you're fighting those effects of muscle wastage, as we said. It obviously helps tissue repair. And when you do start doing exercises and causing little micro tears in your muscles and other connected tissues, then the protein is going to help repair that. Omega-3s, which are always good for anti-inflammation, and vitamin D and calcium for bone and joint support. I'll put together a little shopping list and I'll stick that in the single link that will take you to Amazon in the description below. Next, there's some questions you should ask your surgeon. You want to know what graft they're going to be doing and why that is specifically the best choice for you. Just because they like doing it might not be the right reason for you. They've all got the pros and cons, so just talk to the surgeon about that. Will there be any additional repairs? So will you have to have any meniscus repair? It's quite common when the meniscus is damaged as the ACL is injured. So it's not uncommon for them to be both repaired at the same time in surgery. But just knowing that gives you a bit of a clue as to what's ahead in your rehabilitation. As to what weight bearing protocol you're going to be following, because this will give you a hint as to what kind of setup you might need at home. If you're going to need support from family and friends to getting about, will I have a nerve block? This is definitely worth asking because it significantly affects the amount of pain you'll feel in the first 48 hours. When should I start physio? Now, most surgeons should be suggesting starting physio straight away. Doesn't mean you're going to be jumping up and down stairs, but doing some sort of physiotherapy will help you in the long term. What should I aim for in the first 2 weeks? Get a target. This gives you something to aim for, and a good surgeon will welcome questions. They'll want a positive outcome. So if you set goals and help them give you the goals to reach, then that's only going to be beneficial for you and for them. And finally, have your rehab plan ready to go way before your surgery date. One of the biggest mistakes I see is people wait for the surgery date and then start thinking about rehab. Or they have the surgery, they wait for the sort of pain to settle and things over the first few weeks, and then they go and source the physio. You want to know exactly what week looks like before you get there. And it's always useful to know what month 6 is going to look like so you can plan ahead. And starting rehab early essentially means you're going to get to the end goal quicker and more efficiently. And the last thing you want to be doing is working out what rehab looks like when you sat there recovering. You want a structured plan that's based on specific goals that you aim to meet throughout your rehab before you progress to the next stage. And that's exactly what my ACL Recovery Roadmap is. It's a complete structured rehab program, and it takes you from day one all the way to returning to sport. It's laid out through a video course, so you'll see exercise demonstrations, me talking you through the aims of the program, what each level aims to get you to reach, and specific goals that you need to meet before you can progress to the next bunch of exercises. So if you want to learn more about that, again, there's a link to the page in the description below. So just to recap, do your prehab, get your kit sorted beforehand, ask your surgeon the right questions, and get your rehab plan ready to go. Anxiety comes from not knowing what's coming. So the more you prepare, the more at ease you'll feel. And just as a reminder, if you want a free ACL survival guide, there's a link in the description below, and there's also a link to my program if you want to learn a bit more about that. And finally, if you want to know sort of a bit of an idea around the timeline and where you should be at certain points after you've had the surgery, watch this video that I recorded the other day. Thanks for watching.